My topic presentation today is Watson Health. Some fun facts from IBM. Watson can read 40 million documents in 15 seconds. Medical data are expected to double every 73 days by the time we reach 2020. So why is this a problem? This is a problem because with the abundance of data, it's harder to actually make use of that data. It's difficult for doctors and hospitals to quickly look at what's relevant when looking at years and years of notes for a patient. There's no synchronization between different areas. For example, if a patient has a regular physician, a psychologist, and a therapist, there's no synchronization between those three doctors. Most of the notes taken by doctors are unstructured, which makes it difficult for future doctors to see the important information. This is where Watson comes in. Watson uses natural language processing to look at doctors' notes and determine what information is important. Watson creates a 360 view for each of its patients to give a snapshot of important things like vital signs, medications, allergies, additional caretakers, and their care plan, among other things as well. Watson also has a large knowledge base that can translate unstructured notes to ICD-10 codes. These are codes used by healthcare providers and insurers. This allows connectivity between Watson and the people that are actually administering the healthcare. Watson works across multiple disciplines. Watson has plenty of assessments in its knowledge base. A doctor can simply pull up an assessment, fill it out, and Watson will then determine the priority level for different levels of care. For example, if a doctor were to visit a home of an elderly woman, they could fill out the assessment for her and figure out whether her needs included physical health, psychological health, or assistance with daily activities. So here's some sample language processing from Watson. You'll see here there's 4 or 5 paragraphs of doctor's notes for an elderly woman named Anne. Watson picks out that she's a fall risk. Watson also picks out that she's slightly underweight, she's had weight loss, and she's not eating her meals. These are all important things that might not jump out at you right away if you're looking at this document. Some more language processing examples. You'll see here that Watson picks out diagnoses like diabetes and obesity. Picks out vital signs, a BMI of 33. It can also pick out medications. And as you can see on the right, it categorizes those so that it's easy when the doctor's looking at their patient to see what their vitals are, what diagnoses they've had in the past, what they're allergic to, etc. So now let's take a look at the global view. Not only does Watson keep a centralized view for individual patients, but it's able to use data from similar patients to categorize diagnoses and treatments. What this does is allows Watson to evaluate what treatments are more effective for what type of patient. This allows insurers to reward providers for more effective treatments. In the long run, this ends up lowering overall health costs. So now let's take a look at some more language processing. This one is obviously significantly more detailed, and Watson has picked up a lot more information. As you can see here, on the right side, Watson has categorized all these pieces of information. So for example, it picks up that she's a 58-year-old woman. It picks up symptoms like dizziness and dry mouth. It picks up diseases like lupus. It picks up a 20-year history of smoking. And it also picks up family history. As you can see there, it talks about a disease that she had with 2 of her sisters. So as you can see, this is kind of important for Watson to be able to categorize this on its own instead of the doctor having to go through and figure out what piece goes where. Watson uses all this knowledge to create evidence-based diagnoses. So as shown in the slide before, Watson highlights things like family relationships, diseases, potential hazards like smoking, and other key data. It starts with the symptoms and comes up with a list of several different possible health issues. It then uses patient history and family history to help narrow it down some more. After that, it'll use medications, vital signs, and test results to give a confidence score to a particular health concern. The health concern with the highest confidence score is then identified by Watson. Watson gives reasons behind that health score. So for example, it will say, because of these test results and these medications that the patient is taking, we believe that the diagnosis is this. This will become very helpful for doctors because it will save time for them, which in turn will save time for the entire medical industry. Watson Health covers more than just the individual patient. I encourage you to take a look on IBM's website because they have a plethora of demos, research papers, and examples for things for us from individual patient health to oncology to many other topics.